So I want us to kind of think about questions that we're gonna be asking the patient. So the patient points to the upper right and states that she's been having pain for the last couple of weeks. So when you look at her mouth, this is what you see. Bless you, Tabby. What questions should immediately be prompted after she says this? Anybody? How long has this been a problem? When did this occur? Painful. So let's be even more specific. On a scale of 1 to 10, 10 being the most pain you've ever had in your life, how much pain are we having? I also want to know, when is it occurring? Is it all the time? Or is it sporadic? Right? What else? Take anything for your pain? What's another thing we might think about? What would be worst case scenario for this dude? Why would we think that? What would cause that? Abscess. Have you had any swelling in that area that you've noticed? People may think swelling is in their whole face. So now we need to be even more specific, right? Have you noticed a little pimple on your tissue above that? If it's no, okay, that gives you more information. Why? Because the dentist is gonna want to debrief before they go into that room. A seasoned clinician, hygienist, is gonna debrief the dentist before they even come into that room. So they know we were all on the same page. Now we can actually get to the root of the problem, because I don't know if you guys feel the same way. When I go to the physician's office, if I debrief the nurse on every single thing that's going on, and then the physician comes in and asks me the exact same thing, it feels like they're not on the same page, right? And it's annoying. You're like, God bless, I'm in pain. Can we get to the problem here, right? So we want to skip that process. So based on this photo, do we need to take a radiograph? Do we need to obtain consent for the dentist prior to do this? No. The ball's in your court on this, right? Because again, if I'm the dentist, let's say Courtney's the clinician. I'm just randomly picking someone. I'm not picking on Courtney, by the way. Let's say Courtney's a clinician and I come in and you haven't taken a PA of this. I need a PA of this, right? So that I can make a diagnostic decision on if this tooth is savable or not, right? So the ball's gonna be in your court with a PA, okay? Now in our clinic, the stipulations are different because you're not a licensed professional yet, right? And that's why you have to come to a licensed professional to get an opinion. But when you're a licensed professional, the protocol is gonna be for you to get this on the front end, okay? How would you describe the tooth and the amalgam to the patient? Because remember, at this point, it's way back in the back of their mouth. They haven't seen it. They can feel that something's different, but they don't know the severity of this, right? So how would you describe that? Would you use the word amalgam? No, because that's talking over somebody's head and it's rude, right? Now you could say, hey, your existing amalgam, which is just another word for metal, or you could just skip that altogether. You just say, hey, you've got an existing metal in the back that's seen better days. Right? That's kind of how I try to make light of the situation, because people get panic mode, right? Money doesn't grow on trees, does it? So that's just an example. Do you have to say it that way? No. Somebody give me something else you could say. You can take a picture of it. That's great. We're gonna get to that in just a second. But what descriptions can we use? I'll give you another example. This metal filling that you have on this tooth is large, and a portion of it is already gone. So what I'm trying to tell you is that this tooth that I'm talking about, there's more filling than tooth. So I'm not sure if it's gonna be easily replaced. I'm not sure if we're gonna be able to replace it with another metal filling. We may have to do something further than that. That way I'm preparing the patient, right? Because how bad does it feel for let's just go to the physician scenario again. If the nurse didn't prep you on some things that need to be done. Hey, just wanna let you know you're probably gonna have some blood work done. Hey, just wanna let you relationship with the dentist as they do you. They're also gonna kind of look at you like, well, she didn't mention any of that, he or she didn't mention any of that. So I think it's important to let them know and kind of prepare them. Now, we're not the dentist. We're not the one restoring that tooth and making the ultimate decision. However, based on this scenario, in my mind, I think it's probably gonna have a crown at this point. Why? Because we don't have much tooth to work with anymore. It's mostly filling. And anyone who's been an assistant probably understands that. So that brings us to the next. Do you need to take an intraoral photo? Good job, Tabby. If so, when are we taking it? When do you need to take this photo during your appointment? So to be more specific, would you take this before the dentist came in or after? Before. Why? So he can see it, he or she can see it, but also for our patient, right? Because if we're sitting there communicating something and they're just kind of in their mind picturing what's going on, they're not gonna be following along with you. They're gonna be like, okay, well, whatever you say, right? And if you show them the x-ray, they don't know what they're looking at all. I mean, I didn't know what I was looking at before being a dental assistant or a dental hygienist, right? And even within dental hygiene school, when you guys started out in school, when you're still learning about things, you still questioned what you were looking at, right? So I think a picture is more relatable with the patient. And in some cases, you can send a picture like this to insurance as well. Okay, so based on the circumstances of this, what information can you give the patient regarding potential recommendations that the dentist may mention? How are we gonna prep the patient for that conversation?
Explain that it might not be a very cheap option to fix. Maybe explain the importance of having it fixed. So, yeah, like rather than just pulling the tooth, a lot of patients might just pull the tooth rather than try to save it.
I think a good keyword may be, this seems like a more complex issue than being straightforward. And I just wanna have a pre-conversation with you before the dentist comes in, because I would want someone to do that with me, right? And just say, hey, I think this amalgam has served you well for many years. You probably got it many years ago. Unfortunately, it's severely broken. These are the potential options that he may mention. I don't know what the decision's gonna be, but I just kinda wanna correct you for things that, may be options for restoring this. If it's worst case scenario and it's gotten to the pulp, how do you explain that to the patient? Because they don't know what a root canal is, unless they've had one before, and even then, they were just told they needed a root canal, right? Emma, what would you say? It is, no one feels stupid here, this is an open discussion, okay?
I could just explain that there's layers to the tooth, in the middle there's nerves. And if it's in the nerves, then the nerves are gonna die. So, the tooth has to come out.
So you could say, there's different layers of the tooth. The most inner layer is the pulp chamber. The pulp chamber essentially is the life of the tooth, right? That's where the blood flows, and that's where the nerve sensation is in the middle of the tooth. This is a pretty extensive fracture. I'm not sure if it's gotten to that point. If it has, just understand that a root canal will be necessary to save that tooth, right? That's option one. Worst case scenario, if we've got to save the tooth, we're in root canal territory, which also is gonna include a crown. Anytime you have a root canal, a crown is a partner to that. Why?
The whole blood circulation.
Go ahead, Whitney.
When you remove the blood supply, it makes the tooth brittle.
Yes. So when we have a brittle tooth, if we've made this investment with the root canal, we've got to cover it up and we have to protect what's left of that tooth, so it can be functional. Otherwise, we're putting an investment in a tooth for no reason, because eventually, long term, it's not gonna work. So you just have to say it's a package deal. When you get a root canal, you get a crown, it's a package deal. Now, it's not all done at the same time. And if that ends up being the recommended treatment, then you get into that conversation, right? Option two, best case scenario, they can refill it. But odds are amalgam's not used as commonly anymore, right? Probably gonna be composite, which is a tooth coloring. So you may have that conversation with the patient. Let's say worst case scenario, this tooth is fractured at the root, is it goner? Then it'd have to be extracted. So you don't wanna induce panic in your patients, but you also wanna prep them a little bit, because can you imagine sitting there and then all of a sudden getting all this news? Here you spent 45 minutes with somebody and then the dentist comes in and it's like, wait a minute, what? I need more information. You see what I'm saying? So this is to kind of get you guys kind of thinking. This is what these case studies are gonna be about, okay? Anybody have any questions or further comments on